Hi, I'm Dr. Rahman, and welcome to Black Women's Health Podcast. Consider the following: higher rate of infant mortality, higher rate of stillborns, higher rate of preeclampsia or toxemia of pregnancy, higher rate of intrauterine growth retardation, higher rate of maternal morbidity and mortality. What's a pregnant Black woman to do? In this segment, I will offer 3 possible suggestions. Stay tuned. Now, I can't take credit for these suggestions because they actually aren't new. But what I have done is present it in a way that will empower Black women who are pregnant or contemplating pregnancy so that she doesn't go through her pregnancy scared that she's going to die while trying to give birth. My first suggestion is Black women should be deemed high risk. Given all of the things that I've just mentioned, higher infant mortality, higher intrauterine growth retardation, higher rate of preeclampsia, higher maternal morbidity and mortality, irrespective of her level of education, irrespective of her economic status, irrespective of all that, just by being Black, she is at an increased risk for having a bad pregnancy outcome. And for that reason, because she is at high risk, one of the recommendations is that she should get an early first trimester ultrasound. The American College of Obstetrics and Gynecology has said that first trimester ultrasounds are the most accurate in terms of dating the pregnancy, meaning knowing her due date. However, it is not considered part of routine prenatal care. And I'm saying taking care of a Black woman is not routine. Taking care of a Black woman is taking care of a woman who's at high risk. And for that reason, she should get a first trimester ultrasound. Usually, first trimester ultrasounds are given to women who are uncertain about when they actually conceived, either because they haven't had a normal period or they've had abnormal bleeding, or maybe they were using some form of contraception, i.e., birth control pills, around the time of conception. Women with uncertain dating often get a first trimester ultrasound to be clear on their due date. The other woman is the woman who is at high risk. Because she is high risk, we need to be certain of when this baby's due because it may determine when or if we do a certain intervention. Some women have said that they can't get an OB appointment prior to 13 weeks. What should you do? My suggestion would be to call your OB, or if necessary, call your primary care doctor, say that you have concerns, say that you're high risk, and ask for a script so that you can have an ultrasound done. First trimester ultrasound that can be done even prior to your first prenatal visit. My second recommendation is that all pregnant Black women should receive a blood pressure cuff. Not only should they receive the blood pressure cuff, they should be told to use it on a regular basis. My suggestion would be that she take her blood pressure once a week throughout the entirety of her pregnancy. She needs to know what's a normal blood pressure. And normal blood pressure means that first number that's systolic is less than 120, and the second number, the diastolic blood pressure, is less than 120/80. She should monitor her blood pressure and not wait for the prenatal visit to have her blood pressure checked. She should know what is normal. She should check her blood pressure at least once a week, more often if she sees that the blood pressure is going up. And if her blood pressure starts to go up, that's an indication that she needs to contact her OB, and that further evaluation needs to be done at that time. The reality is that a blood pressure cuff is relatively inexpensive, and often Medicaid insurance will pay for or provide blood pressure cuffs to pregnant women without cost. And so, if you are pregnant and you don't have a blood pressure cuff, get one. Ask for one. Call your insurance. Talk with your OB. We know that high blood pressure is very prevalent among African Americans. We know that African Americans are tending to get high blood pressure at a younger age. And we know that hypertensive disease during pregnancy is considered one of the preventable causes of perinatal morbidity and mortality. There is such a thing called preeclampsia or toxemia of pregnancy, which develops in a woman who has no history of hypertension, but develops high blood pressure in the second half of her pregnancy. When this happens, she can have involvement of her liver and kidneys, which, left untreated, could jeopardize the life of the mother and or the baby. My third recommendation is that the pregnant woman take time daily to tune in to her pregnancy. Starting about 20 weeks gestation, women start to feel fetal movement. And as the baby gets bigger, these movements get stronger. At 28 weeks, throughout the remainder of the pregnancy, it is often recommended that women do what's called a fetal movement count. Every day, about the same time every day, the mother will stop and count the fetal movement to see how long it takes to get to 10 fetal movements. And that could be a kick, a turn, a jab, any type of fetal movement. And often women will discover that babies have patterns. Sometimes they're more active in the morning or in the evening. And as you get to know your baby, you will be able to identify if there's any deviation from the norm. If there is deviation from the norm, meaning it takes much longer to get to that 10 count, or you don't get to the 10 count at all, that's an indication for you to contact your OB. I like to think that given this close communion between mother and child, that the baby will talk to the mom if she takes time to listen. So there you have it, 3 practical suggestions. These are not new suggestions, but put together and packaged in a way so that Black women can understand that they are empowered by realizing first that they are high risk and doing those things which will optimize their outcomes, such as getting a first trimester ultrasound, such as monitoring their blood pressure throughout the pregnancy, such as tuning into their pregnancy on a daily basis to see if the baby's starting to deviate in his or her level of activity, and being proactive that if you should notice a change in your blood pressure, in fetal movement, that you then contact your OB so that it can be evaluated further. Simple, practical solutions that we can start encouraging Black women to do starting today. And as we end the Black Maternal Health Week, I would like to say kudos. Kudos to Black Mamas Health Alliance for conceiving of and establishing the Black Maternal Health Week to highlight the disparities that exist in this country and to advocate for change. Thank you. Thank you, Black Mamas Health Alliance, for the work that you do. Until the next time, take care.